Side will be shining the spotlight on a critical health issue that affects millions globally, and I am talking about tuberculosis. TB is a serious infectious disease. Is it preventable and curable? What are its symptoms, prevention, and available treatment options? We'll get answers to this question, and who is going to give us the answers? He is with us here in the studio. We have Dr. Joseph Oladimeji. He is the TB, leprosy, and Buruli ulcer control supervisor for Ikeja local government area. You're welcome, sir.
God bless you. Thank you, ma.
So we're talking about tuberculosis now. Let us start from the basis. What is tuberculosis and how does it affect the body?
Yeah, when we talk of tuberculosis, it's one of those tropical diseases that were neglected.
That are neglected?
That were neglected. Okay. It means we don't seem to be conscious of it. And it's being caused by a complex of bacteria called the Mycobacterium tuberculosis. The word complex comes because more of them, 3 of them are common. And by the time you mentioned tuberculosis, leprosy, and Buruli ulcer. So the one responsible for leprosy is Mycobacterium leprae. The one that is responsible for Buruli ulcer is Mycobacterium lazarine. So Mycobacterium now become a compound name for the 3 of them. However, the one that we're concerned now is the Mycobacterium tuberculosis. And naturally, once we inhale it, then there is issue.
You said that it is often neglected. So I'd like you to speak on the symptoms of tuberculosis. What are the early signs that one should look out for?
Yeah. Ideally, when patient comes to the health facility, the standard principle now is that every OPD attendees needed to be screened. And screening means merely asking questions. And there are 4 pertinent questions you need to raise. Number 1, are they coughing? For how long? Because once the cough is up to 2 weeks or more, that person becomes a presumptive TB.
That's like the most common symptom. Cough.
It's one of the most common. We use the word presumptive because the word suspect is very harsh. So we use the word presumptive. We are assuming that they might have TB, and which means you have to progress in your investigation. Others are, if that person is having fever, which is persistent, then if there is weight loss, which can mimic something like HIV, and sometimes it might be fatigue that such an individual will have. Sometimes it comes with chest pain. We have hemoptysis, somebody that is coughing out blood. So all those questions you need to ask your patient. And if the answer to if it's caused 2 out of those questions, especially the first 4, which has to do with cough of up to 2 weeks or more, weight loss, talk of night sweating, as well as the issue of chest pain, then you need to document and progress in your findings to ensure that person is not actually a TB patient.
Is it possible for someone to not present itself with symptoms? Like, because I remember that someone went to run a test and the test came out as TB reactive. And I was asking, does it mean the person has tuberculosis? And he said, no, it's just the person has just been exposed to tuberculosis. I'd like you to respond on that.
Yeah, that is what we call latent TB. Latent TB means that person has gotten some level of bacilli in him or her, but it is not sufficient enough to break down the system. Okay. We are talking, there is difference between TB infection and TB disease. Okay. When one is exposed, I have scanty number of the bacilli. By the time you do tests like mantle test, like blood syrup test, it will be reactive. But that is not to say that that person is already having TB. So we call that one latent TB. If the immunity does not break down with time, that person will get healed up. But if the bacilli are so enormous in the body, to the level that it causes physiological changes in the body, which means the organs affected could not function the way it ought to have functions again. That is when we now have issues. And we do advocate. Some company will say they do blood serum for a particular patient, and they want to sack the patient. I mean, they want to sack that worker because he is reactive to blood serum TB test. It is never a standard until you have undergone the actual standard of testing, which is gene expert and co. By the time we get there, I know answer will come for that question.
So I know that TB is highly contagious, right? So does it mean that someone who is reactive to it it's not a, what's the word now? It's not a...
Yeah, if he can transfer it to another person,
yeah.
at that level, he cannot transfer it.
Okay.
Because if you take the sputum sample at that level, you are not likely to get anything. And once it is not in the sputum, the possibility of transferring it to another person is zero. Because, it exits from the carrier. Whether that person sneezes, coughs, sometimes singing, sometimes talking, depending on the level that is affected. But then you are very sure that it is what that person excretes from both the lungs and the throat that were excreted out that can cause TB. So at the level of latency, it can be transferred.
I would like you to also speak about how tuberculosis relates with other sicknesses.
Yes, there are some that they look alike. Most of the time, if you have an imaging done, meaning either you do chest X-ray is not going to tell you this is TB. The highest we see is suggestive of TB or TB suggestive. But sometimes it all depends on that or the person that actually review the film. Another person may say it's pneumonia. So when you talk of cough, there are several things that cause cough. Of recent, there is an outbreak of diphtheria. Diphtheria equally is characterized with cough and fever, just like you have tuberculosis. So other things that you can think of, any disease at all that affect the upper respiratory tract, including pneumonia, which I've mentioned. You want to talk of diphtheria, which I've mentioned. You want to talk of pertussis. You want to talk of even asthmatic attack. Sometimes some people may mislabel an asthmatic patient to be a TB patient. And that is why the issue of examination becomes important before you label a patient.
All right, and let's talk about awareness now. How fully aware as a nation, Nigeria, and as a state, Lagos, when you look at the activities of government, do you think the government is doing enough, to ensure that people are aware about tuberculosis, its preventions?
Yeah. To some extent, the state is doing our best. As at last year, all the wife of the governor, the first lady, were empowered by the first lady of the country so that they are TB ambassador for the state. The first lady, in turn, actually shadowed the responsibility at the local government to the wives of the chairman as the TB champion. And almost every local government had their program executed last week, and it is a continuous program. During that program, there is a level of awareness that goes around the community to sensitize them. But the challenge we have is when people talk of TB, even somebody who is actually a TB patient is not ready to listen to you. We have seen situations where...
Why is that?
We have seen, because of the stigmatization. Somebody who has been diagnosed with TB, you put a call across, so you have gotten your result. Say, lie over my dead body, is your father is not the rest of them, which is self-denial. But when you talk of awareness, the state is doing our best. That is not to say there is no room for improvement. Just last week, somebody came, and I got to know that he said he's been in and out hospital for some times. This man told me he has committed close to $500,000 for tests and all the rest of them. Whereas our TB test and treatment are free.
Government hospitals? In
government hospitals, even some selected private hospitals too. Over 1,000 private hospitals were engaged by the program, and we support them by giving them drugs, the tools, and every other thing that they needed. So, but because up till now, we still have some people that are not fully aware. So, and that is why I will appreciate this kind of program that is going on. As many people have stumbled on this program, at least they would have gotten one information or the other to add to the one they had before. And if they have not gotten anyone before, that is going to be the basis by which they can now start to serve as a megaphone for the program and tell other people.
For someone who is living in self-denial, how can you help such individual? And again, is TB curable?
Oh, absolutely. TB is curable. Once you examine the patient and you detect that they are bacilli, the person is commenced on treatment depending. Because let me mention that sometimes we also classify TB based on the site that it affects. If it is
different types,
I say based on the site,
it affects.
yes, or the organs that it affects. TB bacilli is one, so tuberculosis is one. But if it affects the lungs, for example, we call it pulmonary TB. But if it affects any other organs of the body,
what are the likely organs that could be affected?
there's no organ that it cannot affect. We have managed TB of the eye, TB of the breast, TB of the testes, TB of the bone, TB of the brain. There is no organ in the body that is spared of TB. So what I'm saying is, if it is pulmonary TB, for example, the management is for 6 months. We have 2 segments of treatment, 2 months intensive, and 4 months of continuation, during which there is going to be follow-up test. But if it is TB, it's extrapulmonary TB, especially if it affects the bone or it affects the brain, then that treatment lasts for 12 months. 2 months of intensive and 10 months of continuation. Other class comes because by the time a test is conducted, the resistance nature of the bacilli gives another class. If the frontline drug that we use, which consists what we call the RHZD, let me not, so that people will not start to go to chemists and say they are looking for this drug. This one, they cannot even get it in the market. So if it is sensitive to that drug, we call it drug-sensitive TB. That is DSTB. But if it has gotten to a level that the bacilli resist that frontline drug, that person will become drug-resistant TB. You know, that's another class. And when it's drug resistance, which means that person cannot benefit from the frontline drug, he has to be moved to second-line drugs. And what causes that? Most of the time, when people have TB, because possibly they do not know, they continue to buy antibiotics. You see somebody using antibiotics for 6 months, for 1 year. So which now make the bacilli to resist those antibiotics. But attention, they must have been using part of the drug that was supposed to be used ideally. But when I say RHZD, 4 combinations of drugs were matched together. But if he decides to buy only one, use it at another time, buy only one and use it, there is no way it's going to work. So for those ones that are drug resistant, their own treatment lasts for between 9 months and a year.
This will now lead me to the question of how important is early intervention, you know. And then you'd also talk about, you said it can affect the eye. Are there special symptoms to that, or is it when it has gotten to the, what's the word now? It has gotten to the stage where it cannot be managed anymore, then it begins to affect other organs?
Yeah, number one, as a public health person, the first step or the first intervention to stop the transfer of diseases to other people is early diagnosis of the carrier or the victim. It's like you have 3 parties. You have a carrier by your right, you have a susceptible individual by your left, somebody is at the middle, who is going to help you to transfer. So if that person at the middle is removed, there is no way the carrier can now reach the susceptible individual. So once there is early diagnosis, because part of what contributed to the spread of tuberculosis is overcrowding. And that is why it is more endemic where you have overcrowding, with house crowded together, with 10, 12 people living in a room. But in a situation where a particular individual is living in a duplex or two of them, you know, the level of their interaction is very mild. So even if one carries, the tendency of giving the other one is mild. So that is the first thing to be done. Then once diagnosis is made, then that individual is placed on treatment instantly. As of today, once we diagnose a patient in Lagos State, I am assuring you, within the next 24, 48 hours, except to pull a call across and that person is not responding, that is when the treatment could be delayed beyond that.
Are these treatments free?
I've mentioned it, that the test and treatment for TB is free in all our PACs and selected private facilities that partners with the state or the state partners with.
I just needed you to reiterate it again so that people can hear.
I said TB tests and treatment are free. And when we talk of tests, ranging from the gene expert, and because we have over 30 gene experts here in Lagos, which is the gold standard, but the other one like TrueNat and whatever, I wouldn't want to take you to that. Then there is X-ray van. We have 3 of it. You will have seen the picture of the first lady as the logo of that chest X-ray van. This X-ray van goes from community to community for screening. The basic thing it does is to screen. It's only those who now presented symptoms through the X-ray. Possibly they are able to see one opacity, cavity, and all the rest of them. They now say suggestive of TB, then you can now go ahead and conduct further examination. And the reason why you need to do that is, imagine we only suggest. The one that can tell you either that patient is resistant or is not resistant is either you do gene expert or you do culture. So that is why gene expert is the gold standard for commencement of patient on treatment, except if it is not available, then you can now use your history and you continue. And just like we have said, for somebody having extrapulmonary TB, you are not expecting cough. It all depends on the site affected. A particular case, they were trying to manage impotency. That was when they take the semen for examination, only to dictate that there is TB bacilli in the semen. So which means the testis is affected.
And he wasn't coughing.
Oh, he wasn't coughing. So the bone could be affected. And for you to dictate that, possibly that person is complaining of bone pain, they may have been treating rheumatism, they may have been treating this, lumbago, and all the rest of them. By the time they take the cerebrospinal fluid for gene expert, they detect there's TB bacilli there. That person may not cough too. But what we suspected is that by the time these bacilli were inhaled, they disseminate. They disseminate. Most often, when people cough, typically when you say you are having a cough, it says an ordinary cough. And by the time they start to swallow the sputum that has bacilli, don't forget, it passes through the alimentary canal. It's going to be absorbed into the body. And that must have possibly been one of those reasons why we now have the extra pulmonary tuberculosis.
Wow. I would also like you to talk about TB in pregnant women and children.
Yeah. It's a situation we don't actually like, but it do happen. Because if a pregnant mother has TB, it is not as if she can transfer the TB to the child into. No. But after delivery, when breastfeeding, the baby is facing up. The mother is facing down. And when the mother coughs, it coughs directly into the nose of the baby. And that is why we have children 2 weeks, 3 weeks, 4 weeks.
Old.
TB positive. They were tested using their stool. And the major symptoms they produce most of the time is either failure to thrive. They are not growing as expected, or they are having low-grade fever. And they are moving from hospital to hospital. It deserves a sense of presumption for a health worker to now refer that person or think, with this BTB, let's take the stool sample. And when the stool sample is examined, the same result that we get if you have taken the sputum sample is what we get from the stool. So TB in children is a very serious issue. However, we have treatment for them, though the only pathetic situation is, unlike an adult that you can swallow your drug, So you have to crush the drug. And the same number, the same combination that another adult is taking is what they're taking. Though what determines the number of tablets or the quantity we take is the weight. So they are going to be given according to their weight. However, for pregnant women, they still take TB drug, except they have some other contraindications which will stop them from taking the medication. It's only for drug resistance that you want to look at the pros and the cons. Which one is more advantageous? And taking antibiotic during pregnancy has its own implications too. So that will be left for the medical officers to not take a decision on what we think is best for this patient.
So this will also lead me to my next question. Is TB preventable? Is there a vaccine for it? What are the lifestyles that one can imbibe to protect
number one,
from TB?
it is preventable.
Okay.
The first thing, just like I mentioned, if somebody has TB, that is what we call contact tracing. We have health workers who will trace that index case home so that those people within his or her environment will be examined. It is good to note that even before the symptoms persist, especially if it's open tuberculosis, the one that has to do with cough and the rest of them, for 2-3 weeks or so, before that symptoms, that person is able to transfer it. And that is why we do a contact tracing. Look at the household. Household means those people that are living together, so that they are going to be screened. And if they are screened, once they have not had TB, we have what we call TPT, tuberculosis preventive therapy. We have drugs to give them so that they will not develop that TB.
Okay.
Then, there is one of the vaccines that are given to children. The first one, at birth, is BCG. And BCG prevents tuberculosis. And giving it at birth, we give an insinuation that it means there is no single immunity against TB at birth. For yellow fever, for measles, until about 9 months. Because research has shown that it will take up to that period before the immunity they have can deteriorate. But for TB, there is no immunity at birth. And when people come, a woman, they want to carry baby, and you don't know who is who.
Yeah.
A TB patient may even come and you may not know. And that is why it is advisable that at birth, let's ensure our children were immunized. Having said that, the issue of PPE is equally very essential. Personal protective devices. If somebody is coughing, it is advisable he or she uses face mask, which will cover both the nose and the mouth. Number 2, that's what we call cough culture. Cough culture means when you want to cough, what do I do? Sometimes somebody wants to cough, he coughs into the hand. If that person has bacilli, the hand is contaminated.
When he shakes someone.
Shake somebody, you have transferred it. You pick your phone, you have contaminated the phone. Somebody has assisted you to pick the phone. You put your money, you put your hand in the pocket, you pick money. That money is contaminated. How many people will touch that money? And this bacilli, with a very good environment, can survive for the next 2 weeks. So that is why the use of PPE, the cough culture, is very, very.
So what's the right way to cough?
Yes, the right position is especially use your left elbow to cover.
Elbow.
Definitely your mouth and nose is covered. There's no way you will use hand that will cover both the mouth and nose effectively. There is going to be an exit of this bacilli. Having said that, lifestyle, like chronic alcoholism, somebody that drinks a lot, smoking, they are not good and they are risk factors to TB. Other systemic problems too, like somebody having diabetes and the presence of immune-compromised ailments like HIV is another risk factor. Because if 10 people were exposed to TB, if one of them is an HIV patient, that person have up to multiply by 5 the tendency of developing that TB than the others. And that is why when we get a patient, before that patient is initiated, if we are not able to assess the HIV status before the diagnosis, before treatment, that has to be ascertained. Because the presence of HIV will not allow the drugs to work well. So in the same vein, anyone that has HIV will have to be screened for TB. So, and when all those things were put together, definitely you will have succeeded in preventing tuberculosis. And finally, the issue of adequate diet is inevitable because our immunity is being strengthened by what we eat. So eat right. Not the bulky food that you eat that matters, but what is the quality of that food. And once your immunity is strengthened, even if you're exposed, the tendency, you will not develop it. It will go latently.
All right. I know my colleague has a question for you. So, Abimbola.
Doctor, I'd like to ask you, what's the duration of the treatment for TB and what are the implications should a person not complete their treatment? Because oftentimes you see people come for treatment and then they just feel, oh, I've stopped coughing, oh, I've stopped sweating, and not complete the duration, you know, and follow through the duration of the treatment. What are the implications?
Yeah, thank you. I have mentioned it, that normally, if it's pulmonary tuberculosis and it is not drug resistance, the standard is 6 months. If it's extrapulmonary of the bone, of the brain, that one is 12 months. Then, for the drug resistance, it's between 9 and 12 months, depending on how fast that person actually responded to treatment. The issue of people commencing treatment and deserting the treatment midway, we call it lost to follow-up. It's one of those factors that is responsible for drug resistance. You have taken it halfway. It's like you are fighting somebody. You slap the person, he fell down. If you are running away, what if you stand up and start to pursue you? You better beat the person and ensure that either the leg is broken so that he will not be able to stand up and pursue you. So in the same vein, when you are managing TB, once you take your drugs well, the TB drugs are so amazing that when you commence the treatment, within 3 weeks or so, the bacilli will not be viable again to even be transferred to other people. But if you treat it halfway, that bacilli, they have not left your body. It's only that they are not viable. Then they will go and recruit ECMOG. So and by the time they now synergize, then that drug will not be able to treat them again. And that is why we have some people, they are coming for treatment second time, third time. We have seen cases of fourth time because they wouldn't take the drug well. Number one. Number two, if one is taking TB drugs and the immunity is bad, then it's not going to work well. That can equally facilitate resistance. So we don't encourage it, and that is why we have some set of workers. We call them contact tracer. Those contact tracer, as they are following up with the household of index cases, they are equally monitoring the patient. We have two basic monitoring strategies. One is that for those that are MTB dictated, which means the bacilli were dictated in their sputum or whatever, at second month, at the 5th month, and at the 6th month when they are terminating their treatment, they run a test. We call it acid-fast bacilli, AFB test. If at 2nd month it is still positive, they give a chance for 3rd month. If at 3rd month it is still positive, then we think of some other way, which means something is wrong somewhere. As we are monitoring the sputum, so we monitor the weight. Is the weight increasing or dropping? Because ideally, weight loss is one of the characteristics, like I mentioned the other time. And by the time the person starts treatment, we expect the weight to appreciate. If the weight is not appreciating or is deflating again, which means the treatment is not effective. So those are the two strategies that we use in ensuring an adequate follow-up.
I was going to ask, but I think you have answered it somehow, because I was going to ask, is it possible after treatment for TB to reoccur again?
Yeah, it is very possible.
Even if you complete your
possible
treatment?
If you are treated and you are cured. Don't forget, sometimes you may have a wound. You may not even know when you have the wound. The wound has healed up, but the scar is there. So if it affected the lungs in a way, I mentioned the other time, possibly there has been cavity, there has been opacity, there has been this, there has been that. Little exposure might trigger it off again, unlike somebody who have not had it before.
Okay.
That is number one. Number two, we have seen occasions where somebody has not been diagnosed, talk less of treatment, possibly because he refused to come out, or possibly he was diagnosed, he has denied treatment. So if you are treated and you are cured, if you are still very close to that person, there is tendency for reinfection. And that person will still have to come back. We now call it a relapse case.
So can it lead to death if one is living in denial and refuses to go for treatment?
You see?
Can TB lead to death?
Oh, yes, TB can kill. We have fatality of about between 15-20%. However, the cause of death in TB, there are two or three. Number one, the presence of other systemic ailments. Possibly somebody is having heart problem, is having and even heart problem is one of the complications of TB too. Somebody is having renal problem. Somebody is an HIV patient. That is co-infected patient. So that person can die. Then self-denial. If somebody will refuse to take treatment and hide somewhere, even for people to see him because of a problem, he's going to hide himself. And if that happened, you can't predict what is going to be the outcome. And this is why all hands have to be on deck to ensure that the awareness continues. Any slight opportunity that we have, let's educate people, let them be informed. Where they are informed, if they are not the one to benefit directly from the information, they might disseminate the same information to others, and who is going to benefit from it.
I also want you to speak to family members who have a TB family member amongst them. What are the ways to ensure that this person is properly taken care of?
Yeah, what we advocate for is that the time when somebody has TB is not a time to stigmatize that person. One of the major challenges that TB is facing is stigmatization. A patient came 2 weeks back. We had to refer the patient to somewhere in the Benue State, but he preferred to travel some 30-40 kilometers to go and assess our treatment rather than assessing it in our locality because she didn't want people to know. And in the same vein, some people have TB, but they do not want their family member to know. However, if we are privileged to have the information, it's a time to help that person. It is a time to show love to that person. Because if you do not manage that person well, he has the tendency of even giving us the TB. That is why the issue of community awareness becomes very sensitive. And we have been appealing, to the World Health Committee. If they see anybody within their community that they observe this person is having some symptoms of TB, if the person is not coming out, let them whistleblower to the health worker in the facility. Then we can see how best to work and approach such an individual, persuade him or her to come to the facility for test. And who knows, if he tests positive, then he will be free to assess his treatment.
Thank you so much, Dr. Joseph Oladimeji, for sharing our insight on tuberculosis and your health. He is the TB, leprosy, and Buruli ulcer control supervisor in Ikeja local government. Thank you so much for the time on the conversation.
Thanks for the time.
The conversation continues after this. Stay with us.
Let the conversation continue.
For staying tuned. An insightful conversation we've had here talking about tuberculosis and your health. You know, and he said something, TB is preventable and it is curable. If you know someone or you are even going through the symptoms, please seek medical help.
Well, yes, and you know, you heard today, once a cough is persistent and it is over 2 weeks, it's okay to have a check. It might not be tuberculosis at the end of the day, but having a health check and just being sure that, you know, there's nothing untoward happening is really important. Because, again, you have a lot of people who would just say, it will go. It will go. And then at the end of the day, you just keep building different things on yourself. And early detection is key. And because I know a lot of people who started the TB treatment and didn't complete it. Thinking, oh, I feel better.
I'm okay.
Yes, and you know, these things, you just need to be sure that, you know, once you start something, complete it. It doesn't hurt you.
And it's not going to cost you anything.
Exactly.
And you know, there was one other thing that he said. When you see something like Joshua will say something
and do something.
Even when these people are not willing to go to the hospital, grab them or blow the whistle, because you are also in danger.
Yeah.
True. So this is where community awareness also plays a pivotal role. At least if they don't want to answer, you talk to people who are close to them. And, you know, just do all you can to ensure that you drag them to the hospital. Because, again, these things, you don't want to get caught. You know,
you know, in this part of the world, we are always very secretive when it comes to managing one ailment or the other. I don't want my friends to know. I don't want my family to know.
And because, again, it's killing.
It is.
Stigmatization is killing, because everybody will start avoiding you like a plague. And you know, everybody, Masumo, only TB, like it's not a death sentence. And honestly, that's the only way people can find help. And so oftentimes, that's why a lot of people don't want to tell you what you're going through, because the fear of being alienated is also very real on them. But you can't also now put the lives of others
in risk.
In danger, because you want to keep your own status secret. So it's not easy.
You also talked about
like you said, you can't put the lives of others at risk. And fine, people will stigmatize you, but is it not better for you to get treated than for you to continue to suffer in silence, staying in the four corners of your house? And before you know it, like the doctor said, it is curable, so it's not a death sentence.
It's not.
So why not come out and get treated?
But it is also a death sentence if you do not get treated.
So that's the more reason why you should come out.
You did ask if people actually die from TB. And
if untreated.
Yes, if untreated. So people die if untreated. So it's your choice. Do you want to die?
Or you want to live?
Or you want to live. So please choose the right path.
Choose life.
Choose life. Choose life. Okay. That's the much we'll take on today's show, the midweek edition. Nana is Wednesday.
Time is flying. But I said it on Monday. Time is flying.
The midweek edition of the conversation is done and dusted with. By Friday, March is almost, you know, over. And of course, the next time you'll be seeing us will be in April.
April Fool.
Who am I owing? Bring money. I mean, who is owing me?
And for those of you, you know, who were so loud about the New Year resolution, this is March.
They play.
Oh my goodness.
How far have you gone with it?
Joy is saying, oh my goodness. Joy, you know you have one.
Yes. So
have you started
driving?
No. What do you mean driving? Have you started kicking?
I can't.
You can start. You can start.
Like this on national television.
That's the only way we can call you out.
She's still cooking the resolution.
It's on fire. That's why I don't make
it go down one day.
It go down which day?
Very soon.
Very soon.
Very
Yeah.
soon.
Very soon.
Okay. The day that Oga will leave you on Ojodu Beja Bridge with the car, maybe you will do Oshukada there and carry the car on your head. Okay, that's our show today. Many thanks for watching the conversation. Tomorrow, Thursday morning at 10 a.m. will be another time to join the crew. I am Abimbola Bello.
Thank you for watching. I am Ajibola Ojeshola.
I am Joy Olu. Enjoy the rest of your day.